Member for Wendouree.
Thank you very much, Deputy Speaker, and it's an honour to be able to speak this afternoon on the Drugs, Poisons and Controlled Substances Amendment Bill 2020. And I thank the Minister for Health, his ministerial office and the department for the work that they have done to bring this important legislation before this House that will save lives. I was in the House and I was very pleased to hear both of our parliamentary secretaries for health, the member for Ivanhoe as well as the member for Melton, talk about this legislation and why it was important to them. And I'd like to reflect on the contribution of the member for Melton in his former life as a very important paramedic. And he spoke with real insight and provided such an important part of the story in terms of our paramedics who find people regularly when they're working on a shift who have overdosed, and the need for them to do all they can to save these people. And it was very interesting to hear about his lived experience of being on a shift and sometimes actually reviving the same person multiple times. And you just think of our paramedics, they are faced with so many challenging situations on every shift. And I have my utmost admiration for our paramedics and our AMBOs in Victoria. We have such an incredible group of people who work so hard as paramedics. So I'd really like to thank them. And I'd also like to thank our nurses and our doctors and our clinicians who work in our emergency departments, who also provide care to people who have overdosed, and that this is very challenging, as well as our community health services as well. This legislation will allow access to essential and life-saving harm reduction products, including the supply of syringes and medication, including naloxone. It will come into operation on the day or the days to be proclaimed, or the 4th of August 2021, if not proclaimed before that date. At the heart of this bill is measures that are focused on life-saving harm minimisation arising from the misuse of drugs of dependence. This approaches the issue of opioid addiction as a health concern through a lens of care and compassion. This bill will widen the authorisation under the Act in relation to the supply of hypodermic needles and syringes. The safer distribution and access to syringes will reduce the spread of bloodborne diseases such as HIV, hepatitis B and hepatitis C. And I'm very grateful to the member for Brunswick for his explanation about how Australia compares to other parts of the world in terms of how our needle exchanges have meant that we have had less spread of these diseases because of needle exchanges, and it's always good to have the member for Brunswick to be able to really provide us that insight. So thank you to him as well. This bill will also allow for the supply, possession and administration of Naloxone or other Schedule 2 or Schedule 3 poison for the treatment of opioid overdose for other purposes. And this will bring Victoria into line with other Australian jurisdictions by allowing health workers in registered needle and syringe programs to directly dispense Naloxone to clients who are at risk of or who may witness an opioid overdose. Our government is also committed to developing options to increase the role of peers in Naloxone programs, with the aim to further allow peers to deliver valuable health interventions. And this means that someone who has had an overdose will have a greater chance of survival if one of the peers who are with them are able to act instantly, which is very important. This bill does not create any new offences, but it does create a new exemption to a range of drug offences under the Act for a person who sells or supplies hypodermic needles or syringe obtained from a Victorian needle safety program. And I would really like to be clear to the community that the proposed amendments that are being made to the Drugs, Poisons and Controlled Substances Act 1981 are not to encourage intravenous drug use, but to reduce harm and save lives. And when introducing new legislation, it's very important that we engage with relevant stakeholders. And in regards to this bill, the Victorian Alcohol and Drug Service providers have strongly agitated for change to improve access to Naloxone and sterile injecting equipment. And I also would like to take this opportunity to thank all our alcohol and drug services workers for the job that they do day after day. And so with this high level of stakeholder engagement regarding this issue, I am very proud to be a part of a government that listens to the community and responds appropriately. In recent years, there's been growing recognition by various governments and community that a greater balance between traditional law enforcement and health-based responses will have a broader positive effect on health and safety of communities. Going back to 2015, the Victorian Parliament's Law Reform, Road and Community Safety Committee was tasked with the very important job of inquiring into the effectiveness of laws and procedures relating to illicit and synthetic drugs and prescription medicine. Its recommendation included that the Victorian Government develop a new drug strategy based on the 4 pillars of prevention, law enforcement, treatment and harm reduction. In August 2018, the Victorian Government published its response to the inquiry, and the response included a new commitment to Victoria's needle safety program to remove the outdated restrictions on peer distribution of sterile injecting equipment. The Andrews Labor government has provided record support to Victoria's alcohol and drug treatment sector and made significant reforms to reduce drug-related harm in this state. Harm reduction initiatives that acknowledge the reality of drug and alcohol use and minimise its effect on the community are a critical element of this government's approach to drug policy in Victoria. This bill will reinforce the progressive and caring ideals that support our most vulnerable Victorians, just like we have done in the Royal Commission into our mental health system and the decriminalisation of public drunkenness. The changes we are introducing will mean that it will no longer be an offence for a person to give a sterile injecting equipment to someone else. This will legitimise an existing and effective harm reduction practice and in doing so support the government's commitment to eliminate the transmission of HIV and eliminate hepatitis B and C as public health concerns by 2030, just 9 years away from now. These initiatives are complemented by our government's delivery of major evidence-based reforms to reduce drug-related harm, including the introduction of real-time prescription monitoring. And I was pleased to join the former Minister for Health, the member for Altona, when she came to Ballarat to do a launch of that event, and Victoria's first supervised injecting room in North Richmond. The success of the facility in North Richmond in saving lives and engaging people who use drugs with health services has validated the government's recent announcement to proceed with a second supervised injecting room in the City of Melbourne. Australia-wide, opioids have been the leading type of substance present in drug-induced deaths over the last 20 years, with a large proportion of these resulting from unintentional overdoses. In this context, the use of naloxone is particularly important. Opioid overdoses deaths remain unacceptably high in Australia. In 2017, there were 2,162 overdoses nationally. According to coronial data for Victoria, 540 people died from overdose in Victoria in 2018, an increase of 58% from 2010, with rates of fatality involving illicit opioids, including heroin and pharmaceutical drugs, historically high. For perspective, the current road toll for last year was 211 people, and in 2018 we lost 580 Victorians to overdose. In Ballarat, between 2014 and 2018, in the community that I represent, there were 29 unintentional overdoses. Sadly, 29 people are no longer with us, not here for birthdays, celebrations, weddings or important dates. Loved ones lost due to overdose are missed every day. And I know this firsthand from families who have lost people to overdose. I recommend this bill to the House. It is important legislation. Thank you very much.
The minutes are